Hi, I'm Elizabeth Swider. I'm the founder and owner of Care is There Geriatric Care Management, and this is a brief presentation about the nature of care management itself. I've created this presentation for the good folks at the Osher Lifelong Learning Institute, and they have a course called Navigating Your Way Through Senior Living Options, and this presentation is part of that course. So first, let's talk about why care managers even exist. Why are they necessary? First, we're living longer. All of us are living longer lives than folks did in previous generations, but we often live those lives with some sort of limitation. It could be a healthcare problem. It could be having lost a spouse that was part of our support network. It could be losing the ability to drive. Many of us are living longer, but we're living with some sort of limitations that we're having to manage. Also, we want to make our own choices in our lives. There are lots of choices are available to us now, and we want the ability to make those choices for ourselves. But most of all, I think the reason that private care managers have become so important is because there's so much fragmentation in the world now. The people that used to be our caregivers were often our adult children, but now families are geographically dispersed really all over the country and all over the world, so we don't always have our adult children nearby to do the everyday things that we need to make our lives work. Also, it used to be our family doctors that would coordinate all of our health care, and now there's so much specialization in the medical process that often our doctors need someone to coordinate them, to be the center of care for us. So private care managers are people that bring the world back into wholeness, that arrange the world so that it works for you. Now, there are several different care management models. I put this together out of my own experience. The care management world is really evolving, so as you look for a care manager, you should decide what it is you want and be sure that that care manager provides the kinds of services you're looking for. You might be most familiar with care management from a social worker or a discharge planner that you may have met in the hospital. And those folks have very difficult jobs because they're busy, they have lots of patients to look after, and they're having to manage your situation not only for you, but also for the hospital. There are financial considerations, there are insurance considerations that they have to consider. Also, those social workers and discharge planners are so busy, it's very difficult for them to get out of their offices and be out in the community finding out what's new and what's available for you. So that is a model you might be familiar with, but many people are starting to hire their own private care managers because it's just so difficult for the hospital discharge planners to keep up with what's available out there in the world. There's also a model that you'll see, which I'm calling here assessment and care plan. These are folks that will meet with you once or twice, maybe even over the phone or online, to find out about your situation and give you some recommendations about what services you might coordinate for yourself in your local area. They'll help you create a plan, and then they might implement the plan, but often it's your next step to implement that plan for yourself. So that's a good option to get you started. At Care is There, we are a full-service care management company, and that means that we can help you figure out your own situation, come up with a plan that will work for you. We will, if you want us to, help you implement that plan, and then we're also available ongoingly to support you, not only to troubleshoot, but with many of our clients, we're seeing them as much as once or twice a week. So we are your partners all the way through your process. Now, I just said a little bit about what we do in full service case management or care management. Here's some specifics about some things that we like to do. Our job is to really manage all the practical things that make your life work. And someone's goal might be that they want to be successfully independent in their own home. Or it could be that a major change has happened. We're often contacted by folks when there's been a health crisis. Someone's fallen and broken a hip or had a stroke or had something that's changed their lives all of a sudden. It could be a general declining health that maybe has adult children that live elsewhere worried that their parents don't have everything that they need or that they want them to have. It could be the loss of the ability to drive. That's a real change in people's lives to where they now need to call on other resources so that they can have available in their lives the things that make their lives work and the things that bring them joy in their lives. It might be the loss of a spouse, and spouses are wonderful teams. Often one spouse will handle one area of life and the other spouse will handle another area. So one spouse may be in charge of the finances and another spouse might be in charge of the house. And when one of those spouses is lost, it really breaks down the support system, and that surviving spouse really needs someone to champion them and to help them recreate their life in a way that works. Or it could be a move to a new community. Sometimes folks are moving to another state or city to be near their adult children, but then they have a stage where they need to get acclimated to that community and integrated in a way that has them feeling fulfilled and like they're a contribution to others, and in addition to other people being a contribution to them. And we also work with quite a few clients that are living in assisted living because they want other experiences and other services that aren't available in their assisted living community. So we provide what we call assisted living enhancement. Now, some specific things that happen as we're helping people do the practical things. Often we are coordinating health care and attending doctor's appointments. That's such a valuable service because I know all of us, when we're in the doctor's office for ourselves, it's hard for us to remember everything we wanted to ask the doctor. It's sometimes hard to remember everything that the doctor recommended that we do. So when you have a care manager with you, they're there championing you, advocating for you, remembering the things that we wanted to accomplish in that appointment, and writing down all the recommendations of the doctor so that all of it's remembered and it can be communicated to the people in your life that are concerned about you. And also we're there to help pick up prescriptions, get durable medical equipment, the things that the healthcare professionals are recommending. We're there to make sure that those things get implemented for you so you have the benefit of that complete process. Arranging home repairs and maintenance, especially if a spouse that used to do that is gone and it's difficult for the surviving spouse to make that happen. And we like to have contacts in the community, recommendations that have been made to us so that we can help someone keep their home the way that they love it to be without all the trouble of having to figure out that area of life. Many of our clients like us to help them handle their bills and paperwork. Often that's just sitting down and looking at the mail together and the bills and making sure that our clients understand what's being requested and helping them make decisions about how they want to handle that. Obtaining and maintaining assistive devices, things like making sure hearing aids are in working order, that glasses prescriptions are up to date, that brakes on walkers and rollators are working properly. It's nice to have someone looking out for you in those areas of life so that the things that you've invested in are working for you. And often we are present, it's very important for us to be present for clients during emergencies. It's being in the emergency room is a trial for everyone, and no one should be in there alone. So we make arrangements to be present for our clients during those episodes, so that they have someone with them that they know and trust, and also so that we can be in communication with their families who often live elsewhere, so everyone knows that their loved one is safe and well cared for. And we bring in specialized services. One of my joys in life is knowing so many of our local senior service providers, seeing what everybody's doing, so that when we see a client who we think there's an area of life that could be better for them, that we can bring in some specialists that might be able to help them in those areas. So that could be physical therapy. It could be we've had people work with memoirists to tell their life stories. Or it could be bringing in a companion to be with our clients to do light housekeeping, that sort of work, or bringing in a skilled nursing agency to do wound care, that kind of thing. So we like to bring in specialists so that you have the benefit of all the services in the community. And it's important, anything else that comes up. Our lives are complicated. There's lots of different things. So and at CareSair, we specialize in being generalists. We want to be able to figure out a solution to whatever situation comes up. And very important is communication with the entire family. We have families that love each other so much, but they're in different areas of the country or the world, and they worry about each other, and they want to know there's someone on the ground with the person that they love who can manage a situation if it comes up, but also be with them, their champion, their advocate, their friend, to make sure that their life is really working for them. So the communication is key. So this is my contact information at CARES Air Geriatric Care Management. I hope this has been a good overview for you about what care management has to offer. And like I said, you can visit our website, find a lot of more information there. And if you'd like to talk to us about a free consultation, just give us a call. Thanks.